You're supposed to be able to do anything with technology, right? So why can't we do it?
We found that the critical care nurses in our group, we all had that similar frustration that it was hard to get everyone on the phone to give a report.
That would probably take quite a few hours for that receiving nurse to actually navigate and try to find that information in the EMR.
You know, our world has been turned upside down in the last 8 weeks. We were, super busy, able to implement virtual care.
When a patient is being admitted from the ED, a COVID patient, there is limited time in the hand of the nurse to scramble and search for equipment and make the room ready and be prepared for this patient.
What if the nurse, with a quick glance, could locate all the equipment needed on this unit?
Having these things, like knowing where to go to get them, just really saves time and effort so that we can focus on the patient.
I can picture Florence, myself, looking for all this equipment in hospital. So I think that's fabulous.
Hi, my name is Charles Drayton, and I'd like to welcome you to the Intelligent Healthcare Experience at a Microsoft Technology Center in Chicago, Illinois. That's right, it's not a background, it's actually real. What you just saw was footage from the nurse hack taken just over a week ago. Over the course of 2.5 days, over 900 nurses, technologists, and healthcare enthusiasts all got together to ask themselves a single question: why can't we? Why can't we make it easier for nurses to find the equipment they need to serve their patients? Why can't we do more rounding virtually? Why can't we perform handoffs from nurse to nurse and doctor to doctor faster and more efficiently? Well, 900 nurses and 30 solutions later, the answer was clear. We can. The demo you're about to watch was inspired by the 2.5 days that I had the privilege of working with the nurses, the technologists, and the enthusiasts. Using a combination of our many capabilities in Azure, the Power Platform, and Office 365, the demo you're about to watch shows what happens when you have a solution designed by nurses and delivered by Microsoft. So the agenda for today is really a reflection of 4 key themes that I noticed over the course of the weekend. The first is, how do we improve handoffs? This was a common point of discussion among nurses I worked with. How do we go from passing off information from nurse to nurse? How do we make sure that the receiving nurse has all the information that they need to immediately continue care with their patient? The second is, how do we round from anywhere? Increasingly, I'm noticing that there are hospitals that are implementing virtual care scenarios. And these virtual care scenarios can really encompass a couple of things. One of them is having a nurse or a doctor working from home and then rounding virtually with patients who are at the hospital. The second is scenarios where the patient's actually been discharged at home, and then you might have a nurse or a doctor who is either at the hospital or working from home, connecting virtually to the patient who is at home. The third is knowing where everything is, and this was a little surprising to hear. I didn't realize how difficult it was for nurses to do all of their prep work, to figure out what equipment is necessary for each patient, to track where that equipment is, to make sure it's in operating order, and to make sure that they all gather it in time to get to the patient in a timely fashion. And the fourth is, more broadly, how do we coordinate care? How do we make sure that there's a continuity of care as we pass hands from the nurse to a primary care physician, or a primary care physician to a specialist, or even from hospital to hospital? And those are really going to be the 4 key themes that will make up the agenda for today. I'd like to introduce you to someone. Meet Sid. Sid is something of a composite character of people who I've met over the course of the weekend at the Nurse Hack. And Sid really represents many of the goals, aspirations, and concerns of many of the nurses who I worked with. So what you're going to see here is how the Microsoft platform can fundamentally transform Sid's journey and his experience in working with not only patients, but with other members of his care team. So the first thing you're going to see is how the platform is able to enable him to more easily review a triage list of patients, so he can know who he should see first and what he should be talking to them about. The next thing you're going to see is how the Microsoft platform and our AI capabilities will not only allow him to know what equipment he should be using, but actually to even locate where the equipment is. So no more having to call around or try and track down the equipment is actually going to be proactively given to him. Next, you're going to see how the platform is able to allow him to review the patient chart at a glance, rather than having to dig through an EMR and look through endless amounts of notes and information and data to know what he should be talking to the patient about. Instead, once again, that proactivity, bringing the information to him so that at a glance he can see who he should be talking to and what he should be discussing with them. Next, Sid spent some time actually working at home. Again, something very common that we're starting to see with hospitals now. So how are we able to still enable Sid to perform his rounds virtually? And how can a Microsoft platform support that? And then finally, how Sid will be able to use the platform where, as needed, he's able to reach out to the care team for specialty care. So what do you say we head on over to the nurse workstation and then let's get the round started. It's using Power Apps, which is an application building platform that clinical teams can launch in just days and often with no coding knowledge. Sid's able to get a triage list of patients he has to see. With our artificial intelligence capabilities, Sid's patients are retrieved from the electronic health record and are triaged by risk score. So this ensures the highest risk patients are seen first. Now, with a single glance, Sid is able to see the most important information about each patient. So Frank here, he's a COVID patient with hypertension. So what equipment is necessary? Well, previously, Sid would have to spend 20 minutes or sometimes longer trying to track down information like that for each patient. Now, in a given shift, that can be up to 3 hours in one day. In this case, with a single click, our AI capabilities can not only identify what equipment is needed for the patient based upon their diagnosis, but also where that equipment is. Now, this is made possible by a combination of IoT-connected medical devices and intelligent sensors and cameras, all of which is powered by Microsoft's technology and then surfaced through this app. So with this, Sid can not only see the available equipment, but he can also see what equipment is unavailable, and also what recommended alternatives exist instead. So once he gathers all of the equipment he needs, he can then proceed to meet the patient. Now, take a look at the patient profile. You can see the most important medical information through this app's integration with a health record. And this is all presented front and center for Sid. Now, there's a lot going on here, so we'll probably need to break it down a little bit. First, you'll see the most recent readings for Frank. As a COVID patient, the most important indicators of health are his temperature and his blood oxygen level. So you can see right here, that's front and center. Now, secondly, his overall risk score is shown. And this also gives you information about why he's in the risk band he's in. So in this case, we notice here, risk band considered high, and his key factors are considered COVID-19, primary, and his comorbidities. So his comorbidities in this case are hypertension and age, both of which tend to have exacerbating effects on COVID-19 as a whole. Now here, rather than looking at sticky notes or paper left all over or trying to track down the previous rounding nurse, Nurse Jasmine left a message within the app that includes really important and critical medical and personal information about Frank. This is a huge time saver for Sid, and it makes his job that much easier. Let's listen in.
Hi, I'm Nurse Jasmine. Patient Johnson is a 61-year-old male presenting to the ED with complaints of right-sided drooping eyelids, headache, and double vision since 2 p.m. yesterday. Vitals are blood pressure 160/90, heart rate 95, temperature 97.8, breathing is unlabored. He has a history of diabetes and hypertension. Last dose of metoprolol given was at 2 p.m. He was seen by the neuro team. The plan is for MRI in the morning and further evaluation. Oh, and by the way, he's a little hard of hearing, so make sure you talk into his left ear. That's his good ear. Okay, thank you.
Thanks, Jasmine. Now, other information Sid needs as a nurse are here as well, including medication history. Microsoft AI once again makes Sid's job easier, and it does that by providing important insights for Sid to note, and it's all right within the app. This includes making note of any potential drug interactions or concerning trends from the connected device readings. SID can take note of these recommendations and use them to determine a course of action, which could include, if necessary, escalating to the physician on call. Further down, you notice there's an embedded Power BI dashboard that combines current connected device readings with historical information from the EMR, and it makes it available through this one app for SID to see. We can use this to make note of any overall patterns, including whether or not Frank is getting generally better over time. As you can see here, based upon these indications overall, his blood oxygen levels are improving as a whole. So Frank is definitely heading in the right direction. If Sid had any questions about Frank's overall history, he can refer to an embedded virtual nurse. This allows him to ask questions about Frank's overall medical history. When was his last fever? When was his last reading? So rather than having to dig through the medical record, the virtual nurse can actually directly answer those questions. All right, let's do a quick recap. We got to see how the solution was able to improve handoffs between Jasmine and Sid by having a recorded note automatically embedded into the patient profile. We also got to see how AI-powered recommendations from previous nurse notes ensure that Sid is fully prepared with the most important information he'll need for each patient he's visiting. That's all improving handoffs. And we saw how Sid was able to use Microsoft's AI capabilities to both determine the best equipment to do his job and to find where that equipment is, including any suggested alternatives where necessary. That's knowing where everything is. So let's fast forward a little bit. Job done. Sid finishes his round and heads home. Because of social distancing policies at his hospital, Sid works from home a few days per week, where thanks to Teams, he can still perform rounds virtually, both with patients at the hospital and patients who have been discharged at home. That brings us to our final two pillars, recording from anywhere and coordinating care. Let's see how Microsoft Teams can help Sid do both. Using Microsoft Teams, Sid has access to the various care coordination and collaboration capabilities throughout the hospital. He also has access to various exam rooms that have Teams installed and that are available for use by patients. He also has access to patients who are not at the hospital, but that are at home using home care rounding. Sid will first take a look at the exam rooms and see who's there in need of a visit. In this case, you notice in Building 1, Floor 4, there are 3 patients. Fast forward a little bit, let's say he's seen them already. And the next thing he wants to do is now start doing more of his home care rounding. So he'll move on to the home care rounding section of Teams. And in here, he notices that there's one patient who's available at home who's COVID and in need of assistance, Eden. Let's take a look. So let's start the call with Eden. And starting the call within Microsoft Teams, you're going to notice a couple of things. The same app that we've talked about earlier persists within Teams with a couple of key differences. Notice here, there are actually some connected devices at home that I can connect to get readings. We'll also notice that there are certain trends that we can pick up as well. So there you notice that her blood pressure was up by a little bit. We also notice her A1C is elevated as well for the alert. These are both reasons to communicate with the care team. So her primary care physician is Beth Howe. So we can actually reach out to Beth and begin a session with her. From here, and also within Teams, Dr. Howe can see a wide variety of information from the EMR, including all sorts of additional clinical information, care plan information, and you know what? Don't worry about it. Today is really about Sid, and that was another journey for another person at another time. Today, Sid's story. So why don't we recap? Using the multiple components of the Microsoft platform working in concert, Sid was able to experience improved handoffs from the previous nurse, along with AI-powered recommendations from previous notes to ensure he's fully prepared. He was able to quickly identify all the needed equipment to begin his rounds. Once at home, Sid was able to continue rounding, attending to both patients at home and discharge patients. And he was able to continue to coordinate care through Microsoft Teams, doing a seamless transition to the physician as needed. This, folks, is the power of the platform in action, and why Microsoft is a potent one-stop shop for digital transformation in a clinical environment. Welcome back. Hopefully you're able to see how our combination of artificial intelligence capabilities, connected devices, data visualization tools, and our collaboration hub can all be used together on a cart, actually much like this one, to allow healthcare workers to achieve more. So what's next? Well, I just told you Sid's story. Now tell me yours, here at the Microsoft Technology Center. Intelligent healthcare experience at the MTC is an ideal place to learn about and design solutions to your own healthcare challenges at no charge. We have out-of-the-box and easily customized capabilities throughout the entire continuum of care, for everything from patient engagement to surgical visualization to AI-powered radiology and far, far more. Using a similar ideation and development methodology to the nurse hack, the MTC's technologists have the knowledge and experience in healthcare to help you create a roadmap for success. To learn more, head on over to www.microsoft.com/MTC or ask your account rep to set up an engagement with us. I look forward to seeing you there. Take care.